So today I presented some of the data from the National Lung Cancer Audit that highlighted, I think, some of the challenges that lung cancer services have really experienced due to the pandemic. And what I think is important is what we were doing in 2019 prior to the pandemic that showed that better outcomes for patients. Whereas in 2020, we've taken a significant step back, unfortunately. What I would love to see going forward is re-establishment of some of the real key initiatives that were shown to be working for our lung cancer patients. So the things that I think would make the most significant difference would be the implementation of lung cancer screening. We know the evidence for low-dose CT screening is strong from the UKLS, from Nelson, from the National Lung Screening Trial, from combining all of that data. We know that there's a significant reduction in mortality for our lung cancer patients with low-dose CT screening. It's really important that we implement that. If low-dose CT screening was a drug, it would have been licensed a long time ago and we would be using it. So we just need to work on implementing it. To be fair, NHS England have upped their rollout of the lung health check program, and it's good to see that that is gathering pace and that we have screening sites now due to be set up in every cancer alliance around the country. I think screening is a real important part of the solution. I think there needs to be ongoing emphasis on symptomatic patients as well. So early detection of those patients by promoting people's knowledge of lung cancer and ongoing awareness campaigns that in the past have shown to be successful. So we need to promote those, and we need to encourage alliances and trusts and CCGs to work together to deliver earlier diagnosis. Another piece of data I presented today was the proportion of patients diagnosed via emergency presentation. And that currently in 2020 was 35%. Even before the pandemic was 31%. So this is patients who are so unwell that end up in a crisis and end up in hospital with lung cancer. We need to do more for these patients. So we need to design and investigate and implement interventions that are going to reduce the emergency presentation rate for patients with lung cancer. We then have a whole raft of newer treatments, exciting new targeted therapies, combinations of immunotherapy with radiotherapy and surgery. These are fantastic innovations, all of which are going to move the needle of lung cancer outcomes further as well. So I think there's a variety of different strategies that I think we can employ to improve lung cancer outcomes going forward.